Death with Dignity Rebuttal by Darian Hill. There is no indirect way for an individual to carry out death with dignity if they use a physician. The only indirect way for them to carry out ending their life would be if they did it at home by more violent means. These cases would lead to a family member finding their loved one in that state, which is not what anyone wants to find. As I stated earlier, in the 11 states that death with dignity is legal, the requirements are being mentally competent, which requires the patient to be able to soundly make their own healthcare decisions. No one can make this choice for them. The patient must be diagnosed with a terminal illness that will lead to death within 6 months. And if I knew I had less than 6 months to live, I think I would be depressed as well. These patients must be confirmed by 2 qualified healthcare providers that they are eligible for death with dignity. The final and most important requirement is that the patient must be capable of self-administering and ingesting these medications with no assistance. If the patient requires assistance taking these medications, they are not eligible for this program, because while it may be their choice, their life is now within someone else's hands. If a patient is not able to self-administer these drugs, they are not able to request the Death with Dignity program. I noticed that you had a lot of statistics from Oregon on your presentation about different data that was collected. You also stated that most patients are depressed because they have a terminal illness, but are not sent for psychological evaluation before being given the medications. So, I wanted to reiterate the lengthy process that a patient must go through from not just receiving the medications, but also being able to even request the medications. In order to request these medications, the patient must meet these requirements. For a patient to receive a prescription, they must qualify for these requirements. The patient must make 2 oral requirements to their physician, separated by 15 days. The patient must provide a written request to their physician, signed in the presence of 2 witnesses. The prescribing physician and a consulting physician must confirm the diagnosis and prognosis of the patient. The prescribing physician and a consulting physician must determine whether the patient is capable. This is the biggest step in this process. If either physician believes the patient's judgment is impaired by a psychiatric or psychological disorder, the patient must be referred to for a psychological examination. The prescribing physician must inform the patient of feasible alternatives to the Death with Dignity Act, including comfort care, hospice, and pain control. Finally, the prescribing physician must request, but may not require the patient to notify their next of kin of the prescription request. If you were diagnosed with a terminal illness, knowing that you were not expected to live more than 6 months, wouldn't you be concerned about your autonomy as well? Terminal illnesses end with the patient not being able to make decisions for themselves and relying on their family members to carry out their wishes when they are no longer able to make them for themselves. I don't know about you, but I wouldn't trust my family to carry out my wishes, which is understandable. My family would not want to let me go and would not be able to grasp the concept that they are hurting me more by keeping me alive rather than just letting me go. Patients can sign a do not resuscitate form that indicates they do not want life-saving measures should they go into cardiac arrest. They want to die if they have a cardiac episode. For patients who could be saved using life support measures, they have the choice to sign a form known as an AMA, which is against medical advice. This form allows them to deny life-saving measures should they need them, which is the patient saying, "Let me die," before allowing a machine to breathe for me. So what is the difference between a patient being able to deny life-saving measures compared to wanting to end their life on their own terms? When they are physically dying and cannot make the choice of whether they want life-saving measures or not, they can sign a paper saying, "No, I do not want that." But when they ask to end their life while they are not laying lifeless on the table, they are not allowed to do that. Mind you, in order to sign an AMA form against life-saving measures, a patient must be of sound mind and body, the same requirements for requesting death with dignity.